So this patient's coming in for removal of a soft tissue lesion on the right side of his neck. This is consistent with, again, an epidermal cyst. The challenge is this will create, whenever you're dealing in the neck, you can see how there's a lot of elasticity. That's what allows us to move our neck back and forth. That's hard to deal with when you're trying to excise a lesion because the skin's more elastic and it fights you a little bit. So when you're seeing these videos, you might think that the scalpel is either blunt or dull, and that's not the case. It's just because the skin type is hard to work with. And so teasing it back through will take us more time. Similarly, because you have the shoulder here, almost like a mountain guarding the neck, it's hard to work within this space. So from a physical perspective, that can be a little bit challenging. We've added the actual 2% xylocaine all the way around and through this. You can't feel that other than pressure, like no pain there. He's a little bit sweaty, so he has an aversion to needles, so this process was hard for him. So obviously he's been told during the procedure if he feels uncomfortable, add some more, but that might be a bit of a challenge for him. So he's got some water in him, he's probably not feeling so fantastic. So this is our number 15 blade here. So Langer's lines of the neck typically run horizontally, which is why this is sort of in this plane. You okay?
Yep.
So opening this up is just a little bit harder than other areas, and that's because of the elasticity of the tissues. So the other thing here too, working with the neck, people always get nervous about, what main arterial systems are here. Could we cause some trouble with like the internal jugular, those type of things? Those structures are all deep, so even though whether we're dealing there's an anterior triangle, there's a posterior triangle of the neck. Regardless of which section we're in, that's very useful when you're doing deeper procedures to sort of say, hey, this is what I should be looking out for. And certainly we don't do anything from a cavalier perspective. You want to be identifying, where you're at and what you're doing. But all of these structures should be beneath the areas that we're looking at here. No pain there at all?
No.
Just gonna go let me shift that leg a little bit. It's just that because I'm going to now shift to this side. So I think I'm going to move it. You okay?
Yep.
So this is the side that's more challenging for me to deal with. So you can tell the shoulder's sort of in the way there. Not impossible by any means, but this is where the combination of the angle becomes a bit more difficult and the elasticity of the tissue makes it a little bit more difficult. Just add that for me. And you're still comfortable?
Yep.
So on the end here, just sort of move that around a little bit. Switch back to the side. So the same thing on this end. I'm just going to sort of dissect that down a bit. So just like other cases that we'll see, so what I'm doing here is trying to dissect down to the hypodermis. So that we can then dissect down and come back around on it. This is hypodermis here, so this is why I'm just trying to cut back on that now. So you can see here, this is just, there's a little bit more swelling there, so I just want to make sure that that part, we're a little bit careful with it. Not from the standpoint of underlying structural issues. I just don't want to rupture the membrane if I can avoid it. So this is actually behind it. This is where I just want to make sure I'm visualizing my structures. So what I can feel here is there's just some pulling here that I'm trying to just break down so this opens up a bit more. So you should be able to appreciate this is all adhesion back through here. And that's what I'm just trying to dissect out. There you go. So now we should expect here, now this swelled a few months ago, so hopefully if it's solidified completely, we should just get firm keratin in this. It's quite firm, actually. Yeah, it's completely solidified. So this is almost like scar tissue through here. So we'll send that off and then sort of see. This is nothing worrisome at all. It's just normal tissue. Keratin's just got a lot of scar tissue through it. But now at least know that that's completely out. So again here, what we want to make sure is that this is clean. So you can see there, that's this little bit of muscle fiber. That's just, and that's the, so that muscle fiber is protecting the underlying vessels that we have to worry about. So again, this is all above that. We want to make sure we have no bleeding in the distal part. So around the edge, if it's bleeding a bit, that'll get caught up in the stitches. But the back part, we want to use a bit of a cautery again like that. Pardon me? Yeah, I'll rinse it too. That's a good idea. It's not hurting? Nope. So as an example, like this area here, which I can cauterize, that's going to get caught up in the stitch, so that's going to be tamponaded no matter what we end up doing. It's just the underlying stuff that we want to make sure if we can get a little bit. And oozing's not a big issue, so I don't mind if the wound bed's a little bit. Oh, I feel that one. See, that's where I try. That muscle fiber there is harder to freeze, so this is where I'm going to try and avoid that. And I don't need to actually cauterize through there anyway, so do a little bit more here. That should be good. Just going to. So certainly if I was doing more work in that area, we would freeze that area more because we don't want to do anything uncomfortable. A little cold. A little wet, sorry. Actually, you just feel a weird sensation. So irrigation is always a good idea just to clean out the wound. Much more critical if we break down inflamed wounds or infected wounds, just to make sure it's all clean. That looks nice and clean. Just here, cauterized area, but no active bleeds, which is good. So now we'll just stitch that closed. This is an area, you can see how it wants to approximate anyway, so it won't add any additional strength with that, so we'll just add the actual surface stitches. This is our 4-0 Proline. This is our non-dissolvable stitch. So here too, this will be the same complication as doing the procedure. This is kind of like doing stitches between fingers in the web space. It's hard because you can't pull the same way because there's something pushing up against it. So in this case, it's his shoulder. So you just have to have shorter ends to make sure that it lays properly. And it'll also be harder to drive these in because of the elasticity of the tissues. So again, it'll seem like these, like the needle on the end of this thread's a bit dull, but obviously it's not. So here's our 3 loops here. So again, normally where I'd pull this way over to the side, I can't. So just work with smaller spaces right on top of it. We want to make sure that's still a good stitch. So you have to be careful. If you can't pull down on it, your stitches will all be loose and they won't be effective. So there's always that balance between making sure you've got good apposition and not tightening it too much. Again, we've said this in other videos. The whole goal here is we just want to make the basement membranes line up. So that means, just add that for me, Rana. That means this side of the tissue is lining up with this side so that those can reapproximate and then heal together properly. When they don't, that's where you get bunching of the actual suture line and it doesn't heal as nicely. So essentially what I'm doing here is I'm taking up the extra stitch, I'm wrapping it around my hand a few times before I actually put in the throw. So I'll do this a bit slower. So here when I pull this out, I grab the needle so I know where it is, but this extra stitch on this side, I'll wrap around my hand. And depending on how much of it is, I'll do multiple loops around my hand. And so then when I'm grabbing this like that, it's around my hand, the extra is, and then I just have little ends that I'm working with. You're still comfortable?
Yep.
Okay, we're almost done. So in here again, we drive this in at 90 degrees, at least to puncture the skin. Once you've punctured the skin, you can turn pretty quickly. But if you try to put it in at anything other than 90 degrees, special areas like this, you'll fight with it, and you can sometimes bend your needle and have trouble. Get it, huh? Very good. So we'll just clean that up, and then we'll see him back in about 10 days.